Okay, sorry for the disconnection. So as I was saying, I was talking about parathyroid hormone, that they are the one that helps to control the calcium level. So when our blood calcium is low, it is this parathyroid hormone that helps to increase it. So and the way they do it is by what? Is by stimulating the release of release of calcium from the bone. So they stimulate the release of what? Calcium from your bone into the bloodstream. Then absorption, they also help in absorption of calcium from food by the intestine, and also they reduce renal excretion of calcium. So they reduce the rate at which what? The calcium is being excreted through the kidney. So they conserve what? Calcium. So all they are after is what? Increasing the blood calcium level. So now what are the disease conditions that comes with it? Hypoparathyroidism, when the parathyroid hormone is low. So when the thyroid hormone is low, so this is the condition caused by hyposecretion of parathyroid hormone by the thyroid gland. And it can occur following thyroidectomy. We have said it earlier. When a patient does thyroidectomy, undergoes thyroidectomy, this patient can have what? Low level of parathyroid hormone, because the parathyroid hormone is located at the back of the what? Thyroid gland. And they might mistakenly cause trauma or damage to this particular parathyroid gland. Then what are the signs and symptoms that you can see when a patient has hypoparathyroidism? There will be hypocalcemia, because I told you that it is this parathyroid hormone that helps to what? Increase the blood calcium level. So anytime we have low level of this calcium, there will be what? There will be hypocalcemia. But unfortunately, the phosphate level will go up. So they are inversely related. So when we have low blood calcium level, definitely the phosphate level is going to what? It is going to go up. So what are the signs and symptoms that we're going to see? You're going to see numbness and tingling sensation. Then another thing is muscle cramps, cramps in the abdomen, in the extremities. Then there's positive Trucy and Chivostek sign. We have talked about this before. It is even in one of your quiz. So I will not have to explain myself again. Then there are signs of over-tetany. We have signs of bronchospasm. You know, calcium plays a major role in what? Muscle contraction. Very, very important. It functions for what? Muscle contraction in the body. So when the calcium level is low, we begin to have problem with different types of muscles in the body. So it will affect the muscles of respiration. There will be bronchospasm, laryngospasm, carpopedal spasm, involuntary contraction of the muscles of the hands and leg. There will be carpopedal spasm. There will be dysphagia. Patients will have difficulty in what? In swallowing. There is photophobia. There is cardiac dysrhythmias. There's seizure. Those are the signs and symptoms that comes down with what? Hypocalcemia. There's hypotension, anxiety, irritability, and depression. What are your signs? What are your interventions? You monitor the vital signs, monitor for signs of hypocalcemia. You initiate seizure precautions, place a tracheostomy set, oxygen and suctioning equipment at the bedside. Then prepare to administer calcium gluconate for these patients. Provide a high calcium diet. Yes, so you give these patients diets that are high in calcium. Why you give them diet that are low in phosphorus? Because the phosphate level is already elevated. Instruct the clients in administration of calcium supplements. Very, very important. Now, instruct the client in administration of vitamin D supplements as prescribed. So vitamin D enhance absorption of calcium from gastrointestinal tract. Then instruct the clients in the use of thiazide diuretics if prescribed to protect the kidney if vitamin D is also taken. You know that what thiazide diuretic does is that it's what? It's conserve calcium. So when a patient is on thiazide diuretics and is still on vitamin D, then you have to take precaution so that patient will not go and have high level of calcium. Then instruct the clients in the administration of phosphate binders. You know the phosphate level is high. So this patient, you want to put them on phosphate binders as prescribed to promote the excretion of phosphates through the GI tract. Then instruct the client to wear a medical alert bracelet as usual. Then let's go to hyperparathyroidism. This is just the excessive secretion of what? Parathyroid hormone. So every signs and symptoms you are going to have here is going to be the opposite of what you have in hypoparathyroidism. So it is almost just opposite. So this is just the excessive secretion of what? Parathyroid hormone. So this patient is going to have hypercalcemia while the phosphate level will be low. I told you that they are inversely related. So when one is high, the other one will be low. The reason why I'm not explaining is that we have spoken about it in all other lectures. So I don't want to keep repeating myself. Patients will have fatigue, muscle weakness, skeletal pain, and tenderness. Bone deformities that result from pathological fractures. Patients will have hypertension, cardiac dysrhythmia, renal stones. Excessive calcium level also causes what? Renal stone. Anorexia, nausea, vomiting, epigastric pain, weight loss, constipation. What are your interventions? Continue to monitor the blood pressure, monitor for cardiac dysrhythmias, monitor intake and output for signs of renal stones, monitor for skeletal pain. Move the client slowly and carefully. Encourage fluid intake so as to wash out all this excessive calcium. Administer furosemide as prescribed to lower the calcium level. We spoke about furosemide yesterday, that it doesn't spare any electrolyte. So it is furosemide that will help us to what? To flush it out. Then administer normal saline intravenously as prescribed to maintain hydration. Administer phosphate because the phosphate level of this patient is low, unlike in hypoparathyroidism. And this phosphate interferes with what? Calcium reabsorption. Administer calcitonin as prescribed. I told you that calcitonin lowers the blood calcium level. So that is why you are giving this patient calcitonin. Then administer IV or oral phosphate, biphosphonates, to inhibit bone resorption. Now, monitor the calcium and phosphorus level. Prepare the client for parathyroidectomy as prescribed. Encourage a high fiber, moderate calcium diet, and emphasize the importance of an exercise program and avoiding prolonged inactivity. Patients, one of the medical management for this patient is parathyroidectomy, which is the removal of the what? Parathyroid gland. So you have to tell your patients before the surgery, you have to monitor their electrolyte level, calcium, phosphate, and magnesium level. Monitor all the level of electrolyte. Ensure that calcium level are decreased to near normal values. Inform the client that talking may be painful for the first 2 days after surgery. Then postoperatively, you monitor for respiratory distress. You have to place the tracheostomy set, oxygen and suction equipment at the bedside, monitor their vital sign, position the client in semi-Fowler's position, assess neck dressing for bleeding, more like when a patient undergoes thyroidectomy. So it's almost the same management that you are going to give to a patient that undergoes parathyroidectomy. You have to monitor for hypocalcemia. You know the parathyroid gland has been removed. So this patient is likely to come down with what? Hypocalcemia. And how are you going to know? They are going to manifest tingling and twitching in their extremities and face. Patient is going to come down with positive Trucy and Chivostek signs. You monitor for changes in their voice pattern, hoarseness, monitor for laryngeal nerve damage. So it's the signs and the management is almost the same thing with the management of a patient who undergoes thyroidectomy. So any questions so far? Any questions so far? So thank you for bearing with us. We have come to the end of the lecture. Do you have a question? Any question? So the quiz on study section 4 has been reopened. It has been the quiz on study section 4 is down to attempt. So it is now to attempt. You cannot attempt it the second time. So peradventure, you have not you are yet to, maybe during your first attempt you had the issue, you can now attempt it the second time. So please, if you have attempted it before and you are okay with your mark, there is no need for you to attempt it again. And please make sure you attend the quiz under study section 8. So we have come to the end of lecture on medical surgical nursing. Please, peradventure, if there is any study section you have not been taking, please read up. Read up. You have your study materials with you. So best of luck. I wish you success as you resume school next week. Bye and have a lovely day. Thank you.